I'm really happy to be here today, and I'm going to be talking about kids today. And for me, the strength of our society really is measured by how healthy are our kids. And I think all of us play a role in that. And I want to talk to you first a little bit about Maya. And this is Maya here. And this is a picture her mom, Anna, sent to me last summer. And she was about 6. And she sent it to me because her daughter was graduating from the health and safety mailings that we send them. And she wanted to say thank you. And I think for me, you know, every year or two I get an email or a call or something like this. And it just makes me stop and remember why I'm so glad I do what I do. And here's what Anna had to say. My daughter Maya just graduated from Child Profile Program, and we are very thankful with the information, resources, and ideas reincorporated into our lives in pursuit of a healthier and happier baby. And she is. Thank you for this final letter. Time goes by, and your program is so helpful to so many parents. So I checked in with her again this late last week because I wanted to use this picture. And she said to me, of course you can use this picture. It was sure a wonderful program. And once again, thank you for all you do to improve the lives of many children, including mine. Keep up the good work. So I think, to me, when I'm talking about kids today, I want to tell you, too, the nugget I want to share is you need to involve them and their parents. You need to involve your target audience in your intervention if you really want to make a difference. So I'm going to talk about child profile health promotion. And for those of you guys who don't know much about it, this is the way the state kind of sends health and safety information to families who have young children in our state. We enroll all young children in the state that are born automatically. We get their information from the birth certificate system, and then we start mailing to them from right about birth until their time they're right before their turn age 6. And the mailings are timed for when a child would need a well child visit. So we're prompting them with information about their visit, what immunizations may be due, and a ton of other health and safety information. And you can see it also is the same database is used to run the state immunization registry too, which is another way families get enrolled. So anybody who's moving in from out of state, if a provider enters information into the immunization registry, they'll also kick into the mailing system. And so one of the things we do to make the system work is we involve the parents. It really is parents as partners. So I think parents helped start this program, and they help give us input on a regular basis. We're always going them to ask. We're asking them to review our materials each year. We're asking them in focus groups and other type of formative research what they think, what they want to know more about. We're asking them through customer satisfaction surveys and web feedback things. I think that is really the key, because all of us are going to bring our own perspective. I come to the table as a mom, an aunt, other people do as well, and we think, well, gosh, what would I want to know as I'm raising my child? But we're trying to reach a lot of parents. So what do we want all parents to know as they're raising their child? And I think this is one of the things, the involvement we have in parents is really what's framed the system, because our primary funding is immunization and well child dollars. We want to get kids immunized, and we want to get them to the doctor to go to their well child checks. But parents don't think of their kids that way. Parents think about their kids' health very holistically. They think about, they're not going to think, today is my nutrition day, and maybe tomorrow I'll pick up that immunization brochure and look at it. They want to think about all aspects of their health. They want to know about what their kids needs to grow and develop to be healthy. And that's what parents told us. They want to hear the whole story about what their kids need. And that helps us as well. We get something in exchange for that, because parents tell us on tougher issues like immunizations that it means more to them because they trust the comprehensive health information we have in our mailings. And so maybe if they were prone to wonder and question a little bit, they're seeing that information in the context of a lot of other information they trust, and it helps them trust that information as well. And so now you're probably asking, but how do you know it works? So you mail a lot of people a bunch of paper in the mail. What does that really do? And I think one of the reasons we know is because we ask. And I think you need to all be asking, and you need to ask in a lot of different ways. And so what we find out is parents do use and look at the materials. They're reading them. They're sharing them with their family and with their friends. And so that's really been really important to us over time. And all of the information we get as we ask has been really consistent over time. And it's consistent in the different areas and the different ways we ask. So when we ask different types of parents, maybe parents who speak Spanish or parents of a lower economic status, they tell us the same things. And it's really important to double check yourself in these different ways to find out, are you doing what you think you're doing? We also know that parents tell us it makes a difference in what they're doing, which is really what we're all after. And so they tell us it helps them remember new things. It helps them remember to get their kids immunized. It helps them to remember to schedule appointments with their kid's doctor and other things like that. So we've heard lots of different things about what parents are doing as well. And so the last thing I want to talk about is kind of where we're going with child profile now. And we're trying to come into the 21st century and be a little more modern in our approaches. And so we are working on developing email dissemination of our materials. And so a lot of you may be out there thinking, okay, email, is that really that big of a deal? We all use email every day, and we've probably been doing it for 15 or 20 years. But we are state government, and we are emailing a lot of people, 470,000 people. And so it's very different than, I mean, the state emails a lot of people, but usually the people we email with are people we have business relationships with, or maybe people we regulate. We're not really mass emailing the public. And so this did take a lot of conversations, but one of the power behind it is, once again, we knew it's what our audience wanted. They had told us through the years, through different types of evaluations and focus groups, that they want to get this via email. And in fact, what they were telling us, and a lot of other data has shown, that parents are online. They're online looking for health information. They're searching that way. So if we know we have a good intervention that works with families, why shouldn't we be there too? Why shouldn't our stuff be part of the mix of what parents are finding? So, but doing that, it's also an incredible body of work to turn something that's what up here, I guess on your guys' left, that's a paper newsletter information into something you would look at if it came to you electronically or if you got it online. So there's been a lot of work to kind of transition the information that we already thought was kind of short and concise to something that can feel like it's short and concise on the web. So here we've got a newsletter on the left, and then we've got the same information that would become in the body of the email. So parents would get an email, and then they're going to be able to click to a lot more information, which is another reason why it's so powerful to be online. We can get them to be looking at a lot more and easily going to a lot more, versus, you know, if you're on a paper copy, you're just referring people and they have to take another step to physically go somewhere else or type in an address. So we're hoping this will help us even further our impact and get people to kind of be looking for more information. It's also going to help us learn a lot more about what are they doing in a way, because a lot of our other evaluation information is self-report. So this way we can really track their actions in a way that we aren't able to do with people looking at a paper-based intervention. And then here is one of our other things. A lot of people are no child profile for some of the growth and development charts, which is what is up right now, or the nutrition information, which are these beautiful four-colored, 11.5 by 17 brochures that fold out and have these charts that can tell you what your child should be doing at a different age. And sometimes I go into my friends' houses and I see these things on the refrigerator or above the changing table. And so parents use them that way. Now, what are we going to do to take something that is that kind of information and have parents interact with it online and use it? And it's a lot more, and so they can understand it in the same ways maybe they are, but looking at it every day if it's over your changing table. And so here's what we've done. We've created a whole new web page that has the same type of information but in a really interactive way. So we've got menus that scroll through the information and boxes that will drop down to tell you more about what's there, and that will help parents hopefully continue to interact with it and use it in a meaningful way. And so that's about it for what I have, but I just really want to kind of remind you one more time, the most powerful thing you can do is to make sure you're really involving your target audience in what you're doing and getting their input as much as you can and going back and asking them again for feedback and kind of revising yourself as you go forward. That's what's going to really help you make a difference. Thank you.